We got to get to work here. All right, welcome to part 4. At least I believe so. This could be part 5, could be part 3. I've slept since then. Completely forgot. Got some sun, watched some football. Whatever part Medicare this is, but today we are going to talk about Advantage plans. That's why I brought in the people with the most Advantage plan experience here to really go over and to get their opinions, get what they look for, get details and coverage. Basically, if you do have to get an Advantage plan, why do you need to pick XYZ? Why do you need this Advantage plan? Why do you need this Advantage plan over it as well too? So we are joined today by Kim, Christine, Victoria, and Christopher. I want to start off with a funny story that I was going to tell you guys before we had to start here. So I was just on the phone with one guy that I helped with his drug plan last year. Okay, and he called in just because he's testing the waters, just like a whole lot of people are. That's why phone's ringing off the hook right now. And we were talking about his drug plan. And then he goes, okay, what about my wife? You go, well, his wife's name is the same as my wife's name. There's just one letter that's different. She has 2 L's. This guy's wife has 1 L. He goes, let me just ask her medications real quick, and I just want to see if everything's correct from what you have. I go, perfect. All right. He puts himself on speakerphone, and he goes, honey, are you still on those 2 medications? You know, easy yes or no answer. What do you think the wife says?
Which 2 medications?
Nope.
You should know that.
Nope. Kim, what do you think? What do you think the wife says?
She says, I don't know what I'm on.
She goes, why?
Oh.
And I go, oh my God, I live in your household. I know exactly what's going, like, that's how mine does. And then he goes, no, like I'm doing insurance stuff. Are you still just on those 2 medications? Again, another yes or no question. And she goes, why? Who needs to know? And I'm dying laughing on the phone because I'm like, brother, I feel your pain. That's me trying to get yes or no questions answered at the house all the time, where it's just a yes or do you want Chick-fil-A? Why?
Because I'm hungry.
Exactly. Exactly. So that's our little funny anecdote today. So to start off, and welcome Penny,
Thank you.
our last Advantage Plan warrior. So we have talked a lot about, well, we already talked about prescription plans. I already talked about supplemental plans. We're now going to chat about Advantage plans here, because it is something that no matter how much we want to do supplemental business as much as possible, you still need to have this in your repertoire. You know, if you focus so much on supplemental and you just have these people who need help with their Advantage plans, you know, you're not going to be very much of an asset to them. Where if you don't really know the side behind Advantage, how they work, what benefits to look for, you could really be hurting yourself as an agent. But then 2, you could be hurting the client, giving them advice as well. So to start, let's go with Victoria. In what situations do you recommend people enroll in an Advantage plan?
Somebody who's on Medicaid.
Okay. Somebody on Medicaid. Any others?
People who simply cannot afford a supplement. Not in the budget.
Okay. Christine, Penny, Kim, anything to add for the type of people that work best with Advantage plans?
Even if they're not on full Medicare benefits, if they have the LIS, if they want dental, if they need vision, they're going to have to pay for those separate on top of their supplement. So they just can't afford it. So it's kind of, and some people are just dead set on that group health thing. They had that their whole life and they want that same thing. They want that 0 a month premium and they want to pay $5 or 0 or to go to the doctor, and they want that. They just want that. Some people are just
right. People who are super healthy who think they don't need health insurance and don't want to pay anything up front for it.
Yes.
And it's an alternative to having nothing.
They just want that 0 premium, and there's just no talking them out of it.
Right.
So
Those people, yeah.
there's that, and they're not on Medicaid, and they probably can afford the supplement. They just don't want it.
Mm-hmm.
So
I think Advantage plans tend to lean towards hard-headed people.
Mm-hmm.
And that is not a stab at anybody. That is
No.
just a
want what you want.
realization
Mhm.
that when you talk to people, they talk about it with people who, when they talk about supplementals that actually go through some health issues or concerns, they kind of see the value behind it. Like the gentleman that I was just talking about, asking his wife about the prescription question. He was like, man, I was on YouTube the other day and I saw this video and this guy was just absolutely bashing Advantage plans, just tearing them apart for 10 minutes straight. And I was like, good for that guy. You know, but then again, too, that guy also has the repercussions of if you just continually kill Advantage plans after Advantage plan, you know, somebody needs help with their Advantage plan, they're not going to go to you because they feel like you're going to call them dumb or stupid or go, why do you have that? What are you doing with that? You know, so I completely agree with you guys. We talk about Medicaid, we talk about income levels, we talk about LIS where you do get some assistance. You know, in that case, Medicare Advantage plans, they do work tremendously just because of how they work with state assistance.
Also, people who are on disability that are not 65 yet. I have a client now who's 63, and he just asks me all the time, are you sure I'm on the best thing? Are you sure I'm on the best thing? My sister or my cousin or my somebody is on this thing where they don't pay anything ever. They had this surgery and they paid nothing. And how do I get that? I was like, calm down. You stay where you are. When you turn 65, you're going to buy a supplement. Then you pay X amount a month, and that's all you pay. Buy a drug plan, that's it. Done. Well, I can't do it now? Well, not unless you want to pay a lot of money because you're not 65. So there's also that.
That's another good one. This is why I have Advantage plan people in the room because just like you said, under 65, that was probably in Texas, right?
Yep.
Under 65 in Texas, the only
Who's not on
only
Medicaid.
supplemental plan that you can get is a Plan A.
Yeah, and that's expensive. And he's not on Medicaid.
It's $500-$600.
Yep, exactly.
I remember we had a girl here that was working. And her mom got diagnosed with narcolepsy, and so she wasn't able to work. So she started disability and coming on to Medicare, and she'd been working here for a few months. And her big thing was she saw what Plan G did. She saw the coverage, she saw the premiums. You know, thinking that she'd be fine at 63 years old. You know, we can get it for $100 or so here. She's around the Houston area. And then go talk to her. And then I remember I was like, look, do the Plan G presentation on your mom, go everything through. She never told me that her mom was under 65. And then it came time to quote. And I go, oh. And she goes, what? She's like, can I not get it? And I go, well, you can get a Plan A. She's like, what does that do? And I was like, basically nothing.
Yeah.
It's a Fugazi plan. It helps you when you're in the hospital. That's about it. But it was $700. And she was like, what?
That's why I told him, stop worrying about it. You're good for now. We got you. I got you when you turn 65.
And actually, people will commonly leave that out that they're younger than 65 because to them it makes sense. Well, I'm healthier. My options should be better. When actually it's the exact opposite.
That's
It's an important question to ask for sure.
It really is. And we're going to dive into kind of how you guys like to figure stuff out and kind of rope stuff in. What I wanted to do, I wanted to start with Kim and kind of, I printed out a explanation of coverage just to give me ideas to go down. Like, we're not going to talk about acupuncture being the end all be all, you know, why you should get an Advantage plan, but I want to go through, you know, certain things that are involved with it. Let me start with Kim here. Why do you think so many people love $0 premium? Do you think it's more of like the feeling of I don't have to pay anything, I'm not obligated to it, because I know it's not a safety thing. So why do you think so many people gravitate towards $0 premium nowadays?
Well, I think that for a lot of reasons. First of all, that's the best one, is you think you're getting, $0 premium. You think they're getting the best thing. Unfortunately, supplements are really not widely advertised. And most of the people I talk to that have always been on an Advantage plan never even knew there was another option. So, so they think that's great. And then again, they're just not being educated by their agent to tell them, however, you have a max out of pocket, which is basically a deductible on your plan of $7,000. And they don't realize that that's what they're paying if they're hospitalized. If they ever really need to use the plan, then they're in shock. And, you know, it's just nothing's free. Nothing is zero. But they like the dental, the vision, the hearing. And of course, when we're talking to those clients, that's what we're pitching is, hey, but look at all these benefits
the bells and
that you're,
whistles.
yeah. And that's what they like, because Medicare doesn't cover drugs, dental, vision, hearing.
Some of those dental things are like $5,000. Not even the not even the D-SNPs.
I'm going to circle back to that.
Okay.
because
I saw a typo
I'm
on the
going-
2023 plan. It was 20,000 or something. I'm like, yeah, that's a typo. That's supposed to be 2,000.
No, I saw that too. That
You
was
see
under
that?
comprehensive
Yes,
and.
that's got to be a typo.
don't say the company name.
No, I don't. I
can't
don't remember what it was.
remember.
I don't remember where it was. It's got to be a typo.
Okay, we'll take a look.
Anyway, but yeah.
But I think, and this is correct me if I'm wrong, guys, too. And Chris, this is kind of your deep dive into what the realm of Advantage plans are, kind of like the lady that we were talking about that was on Medicaid earlier. But I think really $0 premium. I think people purchase it because they don't have to worry about value is the issue. Because if you're buying something that is free, or if you're signing up for something that is free, you're not seeing the actual value behind the health coverage behind it. You're seeing a price tag is what you're doing. Now, a lot of times we'll get into the dental, vision, and hearing, stuff like that, where I'm still a big proponent of that's your last card that you have to play as an agent. You know, you got to go other things, doctors and networks, out-of-pocket cost,
absolutely.
everything like that first. And the very last Hail Mary play you have is maybe that $5,000 dental, situations like that. But really, I think with not only the beneficiaries not seeing the value in the plan, they're just seeing it as a dollar sign. I think a lot of agents that are out there that are doing these Advantage plans see it as what's the easiest thing to sell, something that is free.
Right.
Because when they do these commercials, and if you've noticed, they've already started. I've already seen the Blue Cross one,
They sell
like
themselves.
four or five times, where it's like, let's send you a booklet about everything Medicare for you to pick, and the whole commercial is about this $0 HMO Blue Cross plan. And I'm like, wow, that would be very specific to work for just a few people. You tell me somebody who's really sick that has 5 or 6 doctors on an HMO network, no, not
Yeah.
going to do it.
And those commercials usually geared towards the Medicare, Medicaid people, where they're like food card and extra money back in your pocket and this and that, and it's Medicare, Medicaid people.
Right. Who wouldn't
That's
want free food?
Yeah, that's
for
another
free.
reason too why people will sign up for these Advantage plans, because they have misguided priorities. Their priority is a gym membership, or their priority is the food card. They just won't see anything else. They have this tunnel vision toward this one thing, and the Advantage plan is what offers it.
Mhm.
And we're going to get to benefits towards. I want to go with just the main
Yeah.
first 4 or 5 here, because with it, there are so many little things that you can dive into, just like that you can dive into food card, you can dive into dental. I want to mainly focus on kind of the main things here, but just starting from way down. First and foremost, if you are looking at an Advantage plan, you should never decide what Advantage plan to offer somebody, or have you as a senior decide on yourself based upon how much that premium costs. Because there is not that big of a difference between a $0 premium and a $100 premium for some of these Advantage plans. Not barely any, and that's going to blow your mind as a consumer, because you're going to go, okay, how is this $0 plan cover almost the exact same as this $100 plan? What the heck am I paying for? And they're going to go, I don't see any value in this $100 plan. This $0 premium looks so much better because I at least can save $1,200 a year. So I think everybody, and this kind of goes back to drug plans too, do not let the premium really affect what you choose, because you can get the $0, but it might not cover your drugs as well as the $100 one
Your
does.
copay for your drugs are going to be higher than the
Be
$100.
50-60% versus 23-25%. There's so many factors that go into it. I think it's an easy excuse. Penny, I'll ask you here in a second. I think it's an easy excuse for people to go, well, it's 0. That beats 100. They don't know the value behind it. They don't know how it works. All they see is 0. What's your opinion?
I was just going to say, I had one yesterday that we're going to sign up for a plan that's $72 a month versus his current one, which is 0. But he saw that we talked about the value and the out of pocket and what the difference was. And he already knew that it made sense.
Mhm.
And so, when we get past the 15th, we have a date. I don't remember what day we picked, but we're going to do that exactly for the same reason. I mean, but we did talk about the different value, and some of the some of the bells and whistles aren't things that, I mean, if they already have dentures and they're fine, they don't really need the dental coverage. So they don't even care, so it's important to do your discovery to see what they need and stuff. But that's a prime case of exactly what you're saying. Like, he's going to go with the one that costs $72 a month, but it saves him a lot of money in the long run. So, and his drugs are cheaper, a lot cheaper to pick up. And I mean, it was the way to go for sure.
And that's why I'm always a little weary of telling people, because you don't need an agent to get an Advantage plan. You don't need an agent to get a drug plan. You can go to Medicare.gov yourself and do it. But I don't drive my truck to Christian Brothers down here, the mechanics, and go, you guys get out of the way. I'm going to fix it myself. Let me just use your shop real quick. I don't do that. That's something I'd stand by, that to where this industry, the more that they want to make it electronic and more computerized, the worse it's going to be, because then people are just going to focus on, how does this affect my bottom line? Inflation numbers are up, food prices are up too. People are trying to cut back on money. And where is the quickest way that you'll see a cutback on money? If you cut back on monthly premiums. If you go from Netflix without advertisements to Netflix with advertisements, you're still getting Netflix, but you're saving $6-7 a month. That's the same thought that these people are getting here too, is go, instead of paying a monthly premium, I cannot pay a monthly premium, just come as it goes. That is something that you need to look at, but we'll get into kind of why, because that goes to the next point here. Christine, this is an agent question here. What is the highest max out of pocket that you've seen?
For 2023 is $8,300.
That's in network, and that's not that very high.
That's in network.
Yeah.
Oh,
what
in
about
network.
the out?
What about out network?
To like 10,000, 11,000.
Okay.
But
Penny,
it's
11.9,
in network.
11.9.
What's the biggest combined you saw? 11.9.
Yeah.
Kim?
Yeah.
About 11.9. Victoria?
About 11 out of network. Yeah.
I had this couple in Florida that I helped last year with an Advantage plan. Me and Frank helped with them. Their combined was $13,000 for each of them, and each of them had 3 different surgeries and 3 different hospital stints that year. So that family together was out $26,000 in 1 year just in medical expenses.
Because they had to pay the copay for the hospital stays and
because
the
they had to
surgery.
pay as they use it. Now they understood that. They had money put aside. They knew very well. But I tell you what, when I've never had people more eager to say, I need help with this, than somebody where you do hit like this plan I'm looking at, this PPO, this combined out of pocket's $11,000. And this is for last year here. I didn't want to pull anything new.
Yeah.
But you look at $11,000 as your combined maximum out of pocket. You have to be very careful when looking at this stuff as a consumer. You need to be asking these questions, because that $0 premium might be nice, but in reality, if you hell in a handbasket here and you've got to use everything, are you going to have $11,000 on hand to pay for things? They say, funerals aren't for the dead, they're for the living. Advantage plans aren't for the sick.
Right.
They're for the superb healthy. Because if you are super healthy on an Advantage plan and you go to the doctor once a year, like me and Mike were talking to a lady that just went once a year today, she pays $0 premium. She's also on Medicaid, so it's a little different story. But she doesn't even remember her doctor's name, because she's that healthy and she's 87 and goes once a year.
Wow.
And that's just her, for her, that is tremendous.
But that's also rare.
Yeah.
It's
You have to be careful with those Medicaid, Medicare, the dual plans too, because if somebody loses their Medicaid status and they don't realize it, they've got a max out of pocket there too.
Exactly. And see, she didn't know she was on Medicaid. Those are the ones I love, where Mike was like, I can't believe she didn't tell me she was on Medicaid. And I was like, I'll find out. I'll figure it out eventually.
Plus, he asked her, and she said no. And then you asked her back a minute and a half later, and she said,
like,
yes.
you on state Medicaid? She's like, yeah.
You helped me with 2 people recently that didn't know they were on Medicaid.
Well, how do you figure out if they're on Medicaid?
There's a few little tips and tricks, and this is more for agents here than for seniors, but this is how, if you think you might be on Medicaid or get assistance, this is where you can first look your prescriptions. How much do you pay for your prescriptions? That is going to tell you. If the maximum you pay for a prescription is less than about $9, $10 or less there, you're getting some kind of help is what you're doing.
Or, I'm sorry, go ahead.
Go
I was just gonna
ahead.
say if their Part B premium is being paid for.
Correct, too. If the Part B, the 170, it's going down to 160.
164. 50, I think.
If they check their Social Security check and they're not deducting $164 from it, they might be deducting half of it, which is 82, a certain percentage. That's number 2. Number 3, and this is a very simple question, just ask them how much money they make a month. That will give you all you need to know. Really, that low, what they deem as low income subsidy, meaning that you have a low enough income that either the federal government is going to help you with your prescription drugs or the state is going to come in and help you with your health insurance. You're really under about $1,500. If you're under that mark, then you can get some assistance. It might not be full benefits to where you pay $0 for everything you do because the state's paying for it, but you might get that prescription help where your insulin only costs $9 now instead of $500 a month.
Right.
That's something that a lot of people don't look into, because I was helping one of the employees here, their grandma, a few weeks ago, looking into a drug plan, and it turns out that she's on low income because it was averaging, it was going to be about like $3,900 for the year for her with her insulin and everything. And she goes, by the way, I got this letter
Purple letter.
from, this letter stating like 75%. And I'm like, is she getting 75% help with her prescriptions? And he's like, I don't know. I just got the letter. And I go, read it to me right now. Read it to me. And that drug plan they were anticipating her daughter was going to have to start giving her money and helping her out here with her drugs because they were just so expensive. That went from $3,900 annual down to like $14,000 because she didn't know that she qualified for the low income help. So that's a really great question that you asked. There are a few different avenues that you can take in order to finding out. It's kind of, once you know it, you got to piece the puzzle together. No, that's a lot of it. Reps will let you figure out what questions to ask and how to ask. But like with Mike this morning, immediately when he put a note in that said does not pay for prescriptions, I go, you're on Medicaid. The state is helping you. So back to out of pockets, just real quick here. Okay. And this is for everybody out there. We're going to get on to doctors next, but you need to be very weary of your out-of-pocket maximum. You need to know what that number is so you are not surprised. If something does happen, if you do get hospitalized, if you are out of network, you need to know that number just because that is your oh crap number. Now, you're not going to oh crap and get $11,000 like we're looking at here with this PPO plan on January 2nd.
Yeah.
They're not just going to check in and then immediately, boom, say, money, please. I need all 11,000 to cover you for the rest of the year. No, it's going to be incremental as bills are coming in. But as a senior, especially too, if you're not making any more money, if you're just living off a certain amount of check or you have a certain amount of savings or retirement, whatever it is, you need to have that in mind because that is your oh crap.
I had somebody that moved to Texas and knew they were going to be going through cancer treatment. So that was what I was looking for. Their doctor being in their doctors that they already had in network, and what was that out of pocket? That was the most important thing, and it ended up being an HMO, which that's fine. They knew that, but that was what we looked at: were their doctors in network and that out of pocket because they knew they were going to hit it.
And that brings us to our next thing too: is with Advantage plans, before you sign any paperwork, because legally you do have to sign paperwork in order to do it. You have to put your name on there. Okay, this is not just, oh yeah, we can do it. No, you got to do some effort on your end. So when people tell me, I don't know how I got signed up for this Advantage plan, and I go, somebody somewhere got your signature on something, because you have to make some type of effort to get enrolled in them. But see, now they got me off on a tangent here. Doctors, thank you. So that is number one in my book. That really is. Anytime we talk to Advantage plans, because the big breakdown, kind of like I was giving to that lady on the phone, turns out she was on Medicaid. She was like, I just don't know how it works. And I was like, well, you have your Medicare, but you just don't get to use it anymore. You're now playing by, I think it was WellCare.
Yeah.
You're playing by WellCare's rules. It's just you have something helping pay what you should have to pay to WellCare in that instance. So when we talk about doctors, that is the end all be all for me. If you don't have doctors in network, if you're just on Medicare and Medicaid, I will tell you in broad daylight, get off an Advantage plan. I go, are the little benefits associated with it really worth you not having anybody in network? You can't even use it. Sure, you might be getting $30 for groceries, but when you go to the hospital, how are you going to pay for that? You can't. You just can't by signing into it. So I think really doctors is number one for me. Is that number one for consensus?
They're always
Right.
check.
I mean, it's
Always
so
check.
rare you would come across a person who's like, oh, I don't even care. I just see whichever doctor's at the, I mean,
And it's usually the Medicaid people that are willing to switch if they only see like one or two doctors. If that like over the counter benefit, all of a sudden they can switch to some other plan and get like $225 a month and a food card
Right,
versus
there
like
might be-
$50 they were getting on
right.
some other plan. And they'll see whoever they have to see because that's the only instance that people will see.
where it can benefit them.
is if they're decently healthy and they'll just see whoever, they don't care because they want that food card. So that's the only instance that I've really ever had somebody say,
Right,
just
it's not
pick
very
somebody
common.
else that I don't
Usually
care.
doctors are the primary.
Yeah, if doctors aren't in network with somebody and somebody, I'd be like, no, your doctors aren't in network, and if everything's set, I wouldn't switch.
So
No
let's
way.
say they've been going to see a certain, like they have a certain primary care physician and then they have like a specialist or can you find out if that doctor's in their network?
Yeah.
How do you do that?
So a lot
You
of these providers, before you even do something, this is also, and I encourage you guys to do this too, before you sell a dental plan, do y'all ask who their dentist is?
I do. I ask if they have a dentist that they specifically have to see, or are they open to seeing other dentists? That tells me what kind of network I'm.
That is I tell you what, we're not appointed, and I'll admit this right here, we're not appointed with Emeritus Dental. It's a dental company, but they do offer major coverage right away at 20% with some of their plans. I've directed 2 people there last month just because there was nothing that we were appointed for in the area. It's very, very dry. And Emeritus was offered, and this guy needed major coverage right away. I go, look, I'm not appointed with him. And he was throwing a fit because I couldn't sign him up. I was like, just go call him and sign up. I don't care. I'm not getting any credit for it. Just go do it. It's my good deed for the day. That's what you need.
The last few people haven't had a dentist, so it didn't, and then it was PPO, so it didn't matter. So
But with it on a lot of these carrier portals, so like if you were to log into United Healthcare, if you're log into Cigna, if you're log into Aetna, they actually have doctor searches, which you can do. But in the system that we have in our CRM, once we put in the doctors, it lets us know what companies they're in network with. But in this case here, Christopher, if you're talking about, you're talking about finding a new doctor, right? A new specialist or a new doctor, seeing if they are in network. There's 2 things you can do. This is for seniors out here too. Number 1, every Advantage Plan company, they have some type of online portal. And they have a search function that is available for you to find this information. I can't tell you how many lovely old ladies I've helped find doctors just by their zip code and within a 5-mile radius and tell them you need to call these people. They're accepting new patients. That's for every company out there online. Number 2, and this is really the route I like to take on this, Christopher, is I like to call the doctor's office with the person on the line. Because nothing will tell you more that, okay, this guy knows what he's doing than saying, okay, let's just call him. They're going to say the same thing I said. They take this insurance, or they have this, or yep, their billing information is wrong. Those are really the 2 easiest ways to see who is in network and who is out of network.
that's right.
And that's the real big, in my opinion, that's the trigger word with Advantage plans is network. Because that is your end all be all. You can have a Humana plan that has $1,000 in food card. You're having tomahawk steaks every night, and you're only making $900 a month, right? But you got this $1,000 food card. Okay, that doesn't matter when you go to the doctor and nobody takes it.
You know, those food cards have a list what you can buy. You can't just go to the
Oh, yeah.
grocery store and buy whatever you want. There's a
Mhm.
list. And I've heard people say there's nothing ever available when I go. Like I can't get anything.
I know,
It's
and
so
there's certain funny
frustrating.
things like cornmeal or something there,
It's-
whatever that can't is
yeah.
not on the list.
Well, it's
you
got to
know.
be healthy.
Yeah,
Yeah.
Healthy food card.
right.
Yeah, you can't be going and buying your like booze for the night or something or
Well,
whatever.
no
but
cigarettes either.
Yeah,
But I mean,
yeah,
So you can't be
like-
ripping cigs with a
Right.
food card. No.
Right. No, it has to
But,
be.
I
A
mean-
lot of times it's produce and
Yeah.
it's specifically produce and
They-
stuff.
they
But
have
I
certain
think the
lists.
customer service store place has a list of what's on the card
It's
that they
not
can
just
take
a-
with them.
It's not a free for all like I think
Mm-mm.
some people think it is.
Mhm.
It's a very specific on what you can buy, kind of like food stamps almost. I think.
Mhm.
That's why it's one when we talk about training agents and doing all of that here. That's why we focus on more of the relationship side instead of the actual product selling of it. Because if you find yourself selling an Advantage plan due to a food card, you're at your
Yeah.
last. You ain't got nothing. You ain't got nothing else to stand on. You have no ammo in your pocket. This is your last resort. I'm just going to throw it out there and see what happens, type of thing. Because a lot of people they don't understand. This is something for you guys too, and we'll get to this. Well, we'll talk about it now here. There are so many benefits in an Advantage plan that you think you know what they are, but you really have no idea. You don't. There was one Advantage plan Victoria found that gave it says like money to your dog
Yeah, for pet food.
for
Right,
pet
there's some
food
of
and for
those
everything.
that-
Service
But
dog.
it had to be a service
dog.
certified service
Right.
dog.
It could
can't
be a
be-
service lizard. or
It could be a
cat,
service
has to be a
condor.
dog.
And it
or-
can't be an emotional support.
And not an
dog.
emotional.
Right.
It has to be
Actual
a
service.
certified,
Mhm.
trained service dog.
Yeah.
But on the sheet, what does it say? It says it's a dog
It says-
fund
It
or
says
something.
$500 for pet food.
Yeah,
Well, for
500.
chronic condition, it
And-
does specify they already have to have
Right.
some kind of a chronic
Yeah.
condition.
Mhm.
And
but
you're right.
What the chronic condition is, it doesn't.
Yeah, it
Couldn't
came
find
down.
out.
You have to find that in
Right,
evidence of
that was
coverage.
the
Sometimes
only
we'll get a list,
benefit
but
that was left
Yeah.
that was better than any other plan compared to his and compared to the others. So I said, I brought it up. He says, "Oh, I have a dog." I said, "Well, I heard it's fairly easy to get him certified." I said, "You know what?" He was like, actually, that would be worth it to change. I said, "You know what? Let's dig into it." We looked at the explanation of benefits. I looked in his state, how the process in getting a dog certified. He's like, "I can do that." He's like, "Yeah, let's do that one." But that was the only thing left that
Mhm.
would have been better than his plan, and he was down for it. And the little research, it paid off.
And there's some of them that'll say $100 towards utilities, $100
Mm-hmm.
towards whatever, $100 towards this, but then in the fine print, you have to have certain conditions in
Right.
order to get those.
right.
Yeah, but the name of the game is you don't sell to that stuff.
Yeah.
It
no.
can help, make a point or be a tipping point, but definitely you don't sell to those things.
The worst thing, and this is why we're talking about kind of some of the benefits added in. The worst thing I hate is when you sell it off of one of those benefits, and then they get the card or they get the packet, and they go, "Why can't I use this? You told me I could use this."
Because they don't have they don't have
Because you don't have a
something.
certain chronic
Mhm.
condition or you don't qualify through X, Y, and Z. Just like, don't you talk about gym memberships too?
Mhm.
Acupuncture, massages. I'm trying to think, what are some of the other obscure ones? The utilities one is one that's
Transportation,
Chronic.
there's rules on
transportation
that.
is a rabbit
Mhm.
hole. Some companies are better than others.
Mhm.
There was one, I think there was like a pest control I've
Yeah.
seen as well
Right.
too.
One of the
But-
options you can pick.
And guess what? On that policy packet, just like you said, it's beautiful where it says pest control and they've got the little cockroach, perfect picture. And you're like, I can have the bug man come out. And it's like, well, you have to be born on a Sunday, 3 p.m.
Right.
in a
Six
rain/snowstorm and have already lost your left foot, like
Right.
type of situation,
Right.
just for you to have a bug man come out and spray the yard.
Right.
But people are susceptible to that because they think, look at all this stuff they're adding in for me. They must really care about me, right?
Mhm.
Even with the food card, you have to be so specific with it because a lot of times, if you notice, it says healthy food card, but in the description, it says what? $400 towards groceries every 3 months. It doesn't say that you can only get things that are green or that are fruit.
Mhm.
And sometimes those are those same people that, oh, I don't need any help, and hang up on you.
Yeah. And you would think as the
yeah.
agent, these insurance companies would make it very clear to the agent about all the details, but they don't. You have to, even as an agent, sometimes dig into the EOB and
Right.
find the details of that
What's EOB stand for?
and the explanation of benefits.
Yeah.
But you mean evidence of coverage is
Evidence-
what you
evidence
really
of
meant.
coverage.
I was saying evidence of yeah.
Go ahead, Penny. Get some.
No, that's it. I shouldn't have, but I mean, it,
No,
yeah,
that's right,
in
yeah.
case there's,
I don't
Yeah.
know, it's like evidence.
the
of-
EOB's after a
Evidence-
bill.
I don't know.
Yeah, I don't know.
This is evidence of coverage. The other one is
Evidence-
explanation of benefits.
explanation of benefits.
Evidence of coverage is your quick.
Summary of benefits is the quick one.
Yeah, that's the
Mhm.
one. I would-
Yeah.
Evidence of coverage is the other one.
So that is, we talk about benefits. You can get lost in the sauce real quick when you do it. You absolutely can. That's why I just hate when we sell off of benefits. And that's the only thing we can do, because you just need to, there's value in everything we do here. There's a value in every plan that is out there. A Medicare Advantage plan can be extremely valuable when you're under 65, when you're low income, when you're super healthy. It can be very, very helpful. But you have to remember, and this is for agents that are learning, Christopher, you guys already know this, but for a lot of seniors out there too, just because your Advantage plan work doesn't mean my Advantage plan is going to work. Just because you have a good time with Blue Cross doesn't mean I'm going to have a great time with
And
Blue
your
Cross.
sister that lives 3 counties over doesn't mean I can get that same plan.
Mm-hmm. Or your sister who's in another state that says, I love AARP. Can you give me a AARP plan? And I go, I can, but none of your doctors are in network. Oh, I don't care. They say that AARP is good. And I go, excuse me? Like, is it worth losing everything
Yeah.
you have? Interesting.
Yeah, because the benefits aren't the same
Mhm.
from county to county to state for whatever.
And your health is not the same as your sister-in-law's in 3 states over, 3 counties
And
over.
that was the next point I was going to talk about. So you guys laugh because a lot of my sayings, I'm a broken record. A lot of my stories, I'm a broken record. But you know what? Christopher, this is for you. Repetition makes habits. Okay? Really does. The more you rep something out, what'd you say, Christine? I don't even need to look at you.
This is the boat story.
Not
Well, if it's pertinent and it's helpful, why not repeat it, you know?
But
Exactly.
Advantage plans are like belly buttons. Never seen two the same. Okay? Because Kim likes that one.
I haven't heard that. I've not heard you say that.
You haven't heard that before? Adrian hears me say that like once a day. No.
And our second favorite is the sausage factory, where you don't want to see the sausage.
Oh
being
yeah,
made.
where
That's
you
the
don't want to
second
see
one,
you don't want to see
yeah.
how the sausage is made. That one or spaghetti on the wall. That's the other one too.
Right.
But your health plan is so individualized with an Advantage plan that you really do have no idea as a consumer. You don't. Sure, you and your wife, your spouse, your husband, you each can get the same exact health plan if you see different doctors, if you have different treatments recommended, if you take different prescriptions. It's not going to be the same. The only way that it's going to be the same is if you are the same person, you go to the same doctor once a year, and the both of you don't take any medications, and you don't do anything else. You just stay at home inside and do puzzles all day. Okay? That's the only way it's going to be the same, just because there are too many variables in this world for you to ever say, because my friend likes Blue Cross, I want to try Blue Cross. Okay? That's great. Your friend could like drugs. Are you going to try drugs? No. Just because they do it, don't mean you have to do it. You know, it's the old story where if your friend jumps off a cliff, are you going to jump with them? You know, and with a lot of seniors out there, you know, referrals are a key thing. Everybody talks to everybody. Healthy people hang out with healthy people. And unfortunately, sick people hang out with sick people. It's just how it happens. So if you get a group of sick people together, they're going to have so many more different experiences based upon their health insurance, more than any healthy person is going to have. Now, why? Why do you think that, Christopher?
Because they have gone through the ringer. They go to see a lot of
Because they
doctors that
have
conditions,
to-
repetition.
Use it. Do healthy people have to use their Advantage plan?
Nope.
No,
Nope. So don't they love that?
Works great. I don't use it.
Works terrific. You know, it's awesome. That's like hiring somebody and they're like, oh, how they doing? Well, I don't know. I haven't seen them, but they're doing great. How many calls they make? I don't know. They sell anything? I haven't seen anything, but they're great.
They're doing great until they're
They're
not.
doing a great job.
They're healthy until they're not.
Mhm.
Exactly. That goes back to the Advantage plans are for extremely healthy people.
Yeah.
Supplemental plans are for unhealthy people. And there comes a point in everybody's life where there is a tipping point where everybody healthy turns sick, or every sick person might turn healthy and have a chance. So that's, anybody got anything else benefit wise to go over?
Well, I think with these plans, unfortunately, you're just going to have to understand as an agent, you're going to have to do a lot of reteaching and a lot of clearing up common misconceptions, because those commercials, they make it
Yeah.
sound like it's free and it's going to cover everything and it's going to be your every desire and need in life. And
They're
it's just as
supposed
good
to
as
be toning
Medicare.
those down a little bit this year.
Right. Well, regardless,
those.
there's a lot of, you have to really, unfortunately, be the bad guy and the bearer of not so great news, and clear pay. Look, all this stuff is not available in all states and situations, nor is it the right choice for all people. And keep them focused on the hospital and the doctor coverage, and the rest is just, fluff.
And comparing plan to plan with those, you get down to the hospital copay. Some of them might look higher, but it's for 5 days, and the other one is 7 days.
Mm-hmm.
And then sometimes if you look at lab work, some of them are like $0 to $75, and some of them are just $150, and some X-rays are like 0 to 20%. Some of them are like $100, and so you can get into the trap of only looking at dental and over-the-counter and doctor visits and vision and prescription costs. But
So when you do the discovery, that's
when you're
ultra important
but-
to make
but-
sure what are they going to use? Oh, they
Because-
have labs 4 times a year?
well,
Oh,
but even if they're
you
not gonna, like, you never know when you're gonna have to have
Right.
labs. I mean, I'm a walking example of that. But you just never know. You're gonna have to go have an MRI or a CAT scan or something. And when you're comparing those things, that's the little tiny details that a lot of agents just don't even look at.
Yeah.
Because it's like, it's a lot to read and think about. So there's a lot of little details in those comparing plan to plan that you really got to look at, because it's hard. Sometimes it's hard to compare them.
I'm sad Kim had to walk away, because this is a story about me and her actually, but we had an individual that was on an Advantage plan, and their big thing was they needed more dental coverage. Okay.
Mhm.
So we were looking at 3 plans. It was between their plan, there was 2 other plans, and there was one that almost tripled her dental coverage. And she was like, great, this is awesome. And Kim was like, hey, can you take a look at this before? I just want to make sure we're doing the right thing. I took a look, in that Advantage plan with the dental, between that one and one that had just about maybe $500 more instead of $2,500 more. Okay. The one that had way more dental, guess what the out-of-pockets were, the copays?
Very much
A lot
higher.
more.
It was not even a dollar sign. It was a percentage copay.
Yeah, see those. I just
Oh.
don't even.
Versus one
Yeah.
where it was a copay of $25. So if your thing is $1,000 and you got a 20% copay,
if I-
good luck paying 200
Yeah.
versus the other one paying 25.
see-
But you
Right.
get more
Yeah.
dental.
If
Yeah.
I see that, I click. Nope.
Any percentage copay is
Yeah, that's bad.
generally a bad thing.
That's bad.
Correct, because there's no
I see
Cap.
why, yeah.
the thing with Medicare. Correct, and Penny, go ahead. Tell
Yeah,
me.
there's
tell me.
no cap.
Mhm.
And so, 20% of $100, oh, $20, I got that. But
Yeah.
If it's $1,000,
Yeah,
if it's
absolutely.
$100,000,
That's pretty easy. to
Well, your
understand.
cap is your out of pocket on there
Right.
for your thing. But yeah, you could hit that quick with your,
Get there
if you have
faster.
a 20% of something, that's for just a doctor visit, that's be
Mhm.
better off buying a supplemental dental policy.
This is what basically all Medicare, we're breaking it down to the core here. This is the question that you have to ask everybody. And this is what you pick up with selector questions just by doing your discovery, going through everything. You have to get to a point and say, okay, how much do I want to be at risk to pay out of pocket? That's what all of Medicare is. That's what it breaks down to where it says, you know what, I'm fine paying $11,000 out of pocket. I just don't want to pay something monthly. Or do I want to pay something monthly so my out of pocket is $233, $226 next year?
Mhm.
Okay. That's what Medicare all breaks down to. But the issue is that when people look at these plans, and what comes up, Christopher, you'll get some experience with this too here very, very shortly, is they look at the premium, they look at the deductible, they look at the out-of-pocket. That is what your eye gets drawn to. That's just like when you go to Costco and you're picking up those plastic containers of chicken breast, all 6 at once. Let me ask you, did anybody here shop at Costco? Okay, do y'all get those chicken breasts?
Yep.
Okay.
I don't.
Do you look at the weight or do you look at the price tag for
I
it?
look at the price tag.
Okay, same thing.
It depends.
What about
I make sure they're all kind of the same, but I've got a lot more people in my house than you
Correct.
do.
So you can, a lot of places, well, I don't know if everybody does it, but they'll tell you the price per volume.
Or price per pound or price
price
per
per pound. I
ounce.
mean, it's all the
Right.
same, but yeah, I look at the price.
Yeah, nobody looks, I don't know why they they have to put the weight on there because that's how they calculate the price. But I tell you what, if this is how people buy Advantage plans. And I have no idea how I came up with this analogy, but the more I say it, I'm like, this is tremendous here. Okay, so you've got your packs of 6.
Is this your pro tip today?
This is my pro tip. Book it, Adrian. Here we go.
Okay, your pack
Okay.
of 6 for $35.
This is how people pick Advantage plans. Okay, you have your 6-pack of chicken breasts, right? You have one that's $24.50, $25, and $25.50.
And that's more like
All-
$35.50 now. Sorry, I'm
But
just there
all-
yesterday.
All of them, you're getting chicken breast.
Mhm.
You might be getting a few more ounces, so you have to pay a little bit more. Out of everybody selecting those, I do it too. What are you going to pick? The one that's $24 or the one that's in the middle because you feel like you're getting a deal. That's how people who don't know how Advantage plans work choose their Advantage plan is they see, okay, this is $0 premium and $11,000 combined. This is $0 premium and $8,000 combined. But here's this HMO that's $0 and $3,000 combined. That looks pretty good. You're telling me I'm $8,000 less at risk than getting the other plan? Sign me up for that.
Yeah, but good luck
If
finding
my
a doctor.
doctor's in network.
Okay, that was the whole point. But this is a good kind of just general idea for you on how it's sad,
Mhm.
how ill-informed some people are because you let some driving factors like the price of it really affect what health plan you pick. I have a call. Brad was talking to somebody today where it's a lady in Advantage plan. I don't know if she was on Medicaid or not, but she hated her Advantage plan. We'll just say she's not on Medicaid for the purpose here, okay? She hated her Advantage plan because her dental benefit was only $1,500 and the dentist that she goes to does not take Humana. So what you're telling me is you're basing your entire healthcare decision on the fact that you have to get a crown and your dentist doesn't take your insurance. You're basing every specialist you go see, your primary care physician, every hospital you go to, you are leaving that all behind saying, I don't care about that. I care because my tooth hurts. And the guy I want to fix it doesn't take my insurance. So you know what? The hell with all my hospital coverage and doctor coverage. I don't need that. I need an Advantage plan that covers my dental better. How?
And sometimes you have to put it that way. These people shock them into reality. Do you understand what you're asking for? You have to.
I can't say the word, but it's butt backwards is what it really is. Okay. Because that's like sending back a $150 tomahawk ribeye. Back, sending it back because they put too much butter on the potatoes. That has nothing to do with the meat. That's all the thrill. That's all the frill and the thrill. That's
Stick
what
the
it is.
potato
It has
on a
nothing to do
separate
with the
plate.
main course. Your main course is that hospital, is that doctor. And you're really going to throw that plan away because your dentist doesn't take it. This is why you need to call us, people. Watching us. Even if you know everything, we don't know everything about Advantage plans. There's new stuff we find out about Advantage plans every day because it is an ever-evolving market. No 2 years are going to be the exact same. No benefits are going to be the same across year after year. Even you people who know that are on Advantage plans, there are some times where you might have it for 2 years. All of a sudden, your benefits change, or your doctor drops it middle of the year. There are too many questions in order to do it. Now, on the flip side, since we're kind of cooling down here, this is my senior tip. This is not a pro tip. This is my senior tip here, okay? If somebody is offering you an Advantage plan, or if they already know what Advantage plan they're going to get you, and you have not been on the phone for at least 30 minutes, that person has not done enough research into your needs and what is best going to suit you. That person, put your medications in, maybe put your doctors in, and just look for the first thing that populated at the top. Because that's projected lowest cost. And they go, okay, this is it. Here you go. They didn't dive into the copays. It could be a 20% copay, but you answer the question that you rarely go to the doctor. So you might have one copay a year and one copay at 20%. It's not too bad when you just have one. Then you get sick and have 2 and 3 and 4, and there's no limit to it. Again, it goes back to
Percentage versus
percentage versus one, and how much you're willing to risk of your own money.
Sometimes it's just a specialist too. That's
Right.
20%. It's then the primary doctor is 0.
Oh, right.
There's so many variables that this is to be confident enough in a Advantage plan, to be picking a plan. You cannot do it in 30 minutes.
Well, so yeah, it seems to me that must have been a lot of the reasoning going behind the federal government standardizing like Plan F and Plan G and so on and so forth, because they didn't want to make it confusing for people. So it's like no matter who you get it from, Plan G is going to be the same, and the Plan F is
The only thing that's different is the price. That's why.
Right.
That's why we like to live in a supplemental. I'm just a supplemental girl living in a supplemental world. Okay. Okay.
Yeah, but with the Advantage plans, all kinds of detail that you have to sift through and figure out exactly what's going on there. So potentially the eventuality of being deceived and ended up in a really bad situation. Perhaps, I mean, you have to tell me, but like catastrophic care, for example, like maybe a lot of people aren't thinking about that. Like, I end up making like, is there a possibility that I'm going to end up like $300,000
No.
in debt? Especially the healthy
Yeah.
people, right? They're way healthy and they're just
Not
they
with
get some sort of
HMO
plan
plans.
because they get
They
some
still
sort
have
of
an
gym
out-of-pocket
membership, right?
max.
Not for out of network.
Oh, not for out of network. Yeah, you're right.
So that goes back to kind of
Right.
what I was saying, where really every plan with Medicare, it's about establishing a limit. You want to know what your limit is. With an HMO plan, there is no limit.
Unless you're
Okay.
traveling.
Unless
you go to that-
I'm trying to make a point.
Okay, sorry.
In HMO, there is no limit if you're out of network.
Yeah.
With the PPO, you do have an out of network limit. Now that could be, in this case here, $11,000 combined with Humana, this Humana Choice Plan. Okay. Or you have your supplemental that is $233, where you know all you have to pay is your monthly premium plus $233, and you're good for coverage. So it all comes down to just you have to find your level that you want, but you also have to create the value for that level. Because if your whole thing, and this is what I tell people on the phone, where it took me a few years for this to kick in, but the older people get, and the older I get too, and I'm almost 30 for crying out loud here. Hey, we got shingles outbreak at the house. Okay, we're a pretty old family. All right. But me learning this at 29, turning 30 here, as people get older, they want to do less. They don't want to have to check and find doctors. They don't want to have to deal with bills. They don't want to be nickel and dime and pull their checkbook out and go to the doctor and pull their wallet out every time they have to go and pay that doctor. The older you get, the more you just care less about all of that. You want it done for you. That is the difference between the Medicare supplement and the Advantage plan to a T, is you're paying somebody to do it for you versus you have to do it yourself.
Okay.
Because if you think about it, you're paying your monthly premium to not have to worry about billing, to not have to worry about claims, to not break your checkbook out every time you go to the doctor. You just have your one deductible, right? With Advantage plans, you're not paying them anything monthly majority of the time, but you have a copay when you go to the doctor. You have co-insurance when you go to the
It's
doctor.
like pay as you go versus prepaid.
The best, this is what we'll end on. Sorry, 12:56. We've had a busy day today. But a wise woman once gave me this analogy here, and I'll leave it with you and everybody here too. Her name starts with a P. Okay. She was comparing it one day to, she was talking to somebody, and she goes, look, here's the basic understanding of it all. Think of a cruise ship. Okay. Medicare is your cruise ship, right? Now, a lot of people who have been on cruises, I have never. Has anybody been on a cruise here?
Not yet. Hope to someday.
Okay. The thing with cruises, you really have two options. You can get an all-inclusive option, or you can get a pay-as-you-go option. The all-inclusive option means you can go to the bar, get as much drink as you want, food as you want. You can ride the slides. You can go to karaoke. You can invite at all the events. You can do everything on that ship, and nobody has to stop you and get your card, get your room number, whatever it is. You're all-inclusive. That's your Medicare supplement. Versus you can go on the ship and pay as you go. So you have to pay for breakfast. You have to pay for dinner. You have to pay for drinks. You have to pay for access to the pool. You have to pay to go on the slide with Mickey Mouse or whatever the heck goes on cruises to see the Vikings or whatever it is. But you have to pay as you go. And those are really, that's the two different types of people in the world. The ones that can say, look, I know something is going to come up. I don't want to have to deal with it because I'm worried about myself. If I get sick, I'm not worried about me dealing with it. I'm worried that Michelle's going to have to worry about it. My parents are going to have to worry about it. They're going to have to step up. They're going to have to help out. They're going to have to do all that here. That's a repercussion that sets in that goes, damn, I better have some good insurance in case something happens.
Well, and a lot of the big cancer hospitals, they do not take Advantage plans. They only take,
Mhm.
I'm just sidebar, they only
We only
take
take
supplement.
Medicare or Medicare supplements.
Yep.
But that's the breakdown in a really in a comparison that you can kind of take away is that your supplement is your all-inclusive ticket. Your other one is the pay-as-you-go ticket. So, you don't get to get 3 meals a day for free. If you only got the budget for one meal, then you might just have to pick between lunch and dinner. Might do a little, I don't know, what's not reverse brunch. I don't know. Drunch. I don't know.
Yeah.
But
Yeah.
you might have to do a little drunch there
And
about
there's no
3 or 4
$20
o'clock.
margarita in your budget.
Yeah, I think
Right.
that margarita's like $50-$60.
Yeah,
So,
exactly.
that is it for part 4 here. Just wanted to say thank you everybody for tuning in. If you do have questions about your Advantage plan, supplemental plan, Medicare, give us a call. We will be here. If you're an agent, go sell something. And if you're a senior, go hug somebody. Thanks, guys.